Welcome to the Explainer. Let's get right into it, because today we are handing you a scientifically rigorous, comprehensive clinical playbook for reversing prediabetes. We are not just going to give you the tired old advice to eat less sugar. No, we are diving deep into the exact clinical data and the underlying cellular mechanics you need to completely reverse this metabolic condition. We've meticulously gathered the latest insights, guidelines, and research to build this exact playbook for you. So let's get started.
To truly understand the sheer scale of what we're dealing with here, consider this stat. An estimated 38% of all adults in the United States currently have prediabetes. And what's really alarming is that if it's left unmanaged, up to 70% of those people will eventually progress to full overt type 2 diabetes over their lifetime. And that brings with it some really severe risks, like cardiovascular disease and neuropathy. But, and this is the absolute most important takeaway for today, prediabetes is highly reversible.
Okay, here's our roadmap for today. 1. The prediabetes epidemic. 2. Nutrition therapy. 3. AGEs and new 5GC. 4. Botanical sensitizers. 5. Micronutrients and fibers. And 6. The reversal protocol.
Section 1. The epidemic, defining prediabetes. Before we can fix the problem, we really need to pinpoint exactly what it is. Prediabetes is basically an intermediate metabolic state. It features profound cellular insulin resistance, even though your blood sugar hasn't quite crossed that line into overt diabetes just yet. So here are the exact diagnostic criteria. You are in the prediabetic window if your impaired fasting glucose is between 100 and 125 milligrams per deciliter, or if your impaired glucose tolerance hits between 140 and 199. Alternatively, looking at glycosylated hemoglobin, or HbA1c, anything between 5.7% and 6.4% is a highly reliable marker. If you are hitting these numbers, your body is waving a massive yellow flag. It is literally telling you that right now is the absolute best time for aggressive lifestyle intervention.
Section 2. Nutrition Therapy Medical Foundations.
The clinical data we have here is incredibly encouraging. Achieving and maintaining a modest weight loss of just 5% to 7% of your initial body weight can reduce your risk of progressing to type 2 diabetes by an astounding 58%. But how you actually get there matters a lot. When we compare different dietary patterns, it gets really interesting. Take the ketogenic diet, for example. It strictly limits carbs to under 50 grams a day, which causes a drastic, very rapid drop in HbA1c in the short term, but it notoriously suffers from really poor long-term adherence. People just can't stick to it. Contrast that with the Mediterranean diet. It allows for a moderate carb intake of 100 to 150 grams, and it is widely considered the gold standard. Why? Because it has incredibly high long-term adherence, and it actively combats the actual root causes of insulin resistance, which are systemic inflammation and oxidative stress.
Section 3. AGEs and new 5GC. Hidden dietary dangers.
All right, this is where we need to shift our focus away from just blindly counting basic carbohydrates. There are actually hidden molecular hazards found in very common everyday foods that are actively destroying your metabolic health behind the scenes. First up, we have Advanced Glycation End Products, or AGEs for short. Let's break down the biochemistry into simple terms. These are highly oxidant, pro-inflammatory compounds that form when sugars physically condense with proteins or lipids under high heat. You might know this as the Maillard reaction. It's exactly what makes browned, roasted, and charred food taste so incredibly good. However, when these glycotoxins build up in your system, they trigger massive inflammation and they physically block insulin from unlocking your cells. It's literally like putting glue in a keyhole. Because of this, how you cook your food is honestly just as important as what you eat. Let me give you a really clear example. If you take a beef frankfurter and broil it with dry heat for 5 minutes, it yields over 11,200 kilounits of AGEs. That's a massive load. But if you just change the method and boil it using moist heat, that number drops down to about 7,400. And it gets even better. If you take ground beef, marinate it in something highly acidic, like lemon juice, for about 10 minutes, and then boil it, the AGE content exponentially plummets to just over 1,500. So using moist, acidic, low-heat cooking methods is a massive and highly actionable trick you can use right now to drastically lower your glycotoxin intake. Now, the second hidden danger we have to talk about is a non-human sugar molecule called new 5GC. This is natively found in mammalian red meat, like beef and pork. Here is the wild part. Millions of years ago, human ancestors actually lost the gene required to produce this specific molecule. So whenever we eat red meat today, our bodies undergo a sort of molecular deception. We absorb this foreign sugar, and our bodies mistakenly incorporate it right into our own cell walls. The problem? Our immune system comes along, recognizes our own cells as foreign invaders, and attacks. This triggers a chronic, smoldering autoimmune response known as xenocellulitis. And this continuous low-grade inflammatory war aggressively drives cellular insulin resistance.
Section 4. Botanical sensitizers, insulin modulation.
Beyond foundational diet changes, clinical data shows us that nature actually provides some really potent tools. Aggressive, targeted botanical supplementation can vastly accelerate the restoration of your metabolic flexibility. First up is berberine. Usually taken at 900 to 1500 milligrams split up throughout the day, berberine activates something called AMPK. Think of AMPK as your body's metabolic master switch. When activated, it suppresses your liver from dumping extra glucose into your blood. But a strict warning here. It interacts heavily with other medications and is entirely contraindicated if you're pregnant. Next, we have Gymnema sylvestre. Taking 400 to 600 milligrams of this before a meal physically blocks intestinal glucose absorption and seriously blunts sweet cravings. It's fascinating. Finally, there's bitter melon, which actually contains plant-based insulin and suppresses glucagon, but it does carry severe warnings for pregnant women and anyone with G6PD deficiency. We also have to give you a really explicit warning about cinnamon. Now, cinnamon is a fantastic, well-known glucose-lowering botanical, but the species you use is absolutely critical. There's cassia cinnamon, which is the cheap variety you find in basically every regular grocery store. The issue is it contains high levels of a compound called coumarin, which is actually toxic to your liver if you use it heavily every single day. If you are planning to supplement daily to manage prediabetes, you absolutely must ensure you are buying Ceylon cinnamon. This is known as true cinnamon. It has negligible amounts of coumarin, making it perfectly safe for daily clinical supplementation to help upregulate those vital glucose transporters.
Section 5. Micronutrients and fibers, cellular cofactors.
It turns out prediabetes is heavily correlated with deep subclinical cellular deficiencies. Think about it like this. If your cells are missing the basic structural hardware required to process glucose, your insulin signaling will stay paralyzed. Here are the specific cellular cofactors you need. First, benfotiamine. This is a fat-soluble form of vitamin B1 that aggressively shunts toxic glucose away from damaging your nerves and blood vessels. Then we have R-alpha-lipoic acid, a master antioxidant that works brilliantly in synergy with benfotiamine. Vitamin D3 is absolutely essential for regulating your beta cell receptors. And then, critically, we have magnesium. Without 300 to 400 milligrams of magnesium daily, your cellular insulin receptors are physically unable to activate. Literally, they cannot turn on, no matter how much insulin your pancreas produces. It's the key to the ignition.
Building on those cellular cofactors, we also have to optimize the mechanical function of your gut. And an amazing starting point is psyllium husk. Here is how it works. When you mix just 3.5 to 5 grams of psyllium husk with a very large glass of water about 30 minutes before you eat, it forms this extremely dense, viscous gel right in your stomach. It acts as a literal, physical barrier, it heavily delays gastric emptying, and physically traps carbohydrates as they digest. The result? It radically blunts the sudden massive glucose spike and the huge insulin surge that normally follows a meal.
To modulate the gut even further, we look at advanced interventions. Milled flaxseed powder, taken at 15 to 30 grams daily, is incredibly rich in STG lignans, which actively lowers systemic inflammation. But remember, it absolutely must be milled or ground up. Whole seeds will just pass right through your system untouched. Then we have targeted probiotics, specifically a fascinating strain called Akkermansia muciniphila. This specific strain actually feeds on your gut mucin. It strengthens the intestinal wall, and amazingly, it actively stimulates your body's natural secretion of GLP-1. That's a very powerful hormone that naturally promotes feeling full and triggers insulin release.
Section 6. The Reversal Protocol, your clinical playbook.
We have covered a massive amount of ground today, from basic diagnostic criteria all the way to advanced pharmacology and cellular biology. So let's synthesize all of these individual puzzle pieces together into your master clinical playbook. Ready? Here it is. Adopt a plant-predominant or Mediterranean dietary framework. Transition to moist, low-heat, acidic cooking methods to strip those harmful AGEs out of your diet. Drastically reduce mammalian red meat to stop that smoldering new 5GC exocyneolitis. Safely integrate AMPK activators like berberine with professional guidance. Actively replenish your cellular cofactors, specifically your magnesium, vitamin D3, and benfotiamine. And lastly, deploy those viscous fibers like psyllium or flax right before your meals.
Reversing this condition demands a hyper-targeted, multidisciplinary approach. As you can see, it goes way, way beyond that completely outdated advice to just eat a little less sugar.
So you now have the full evidence-based toolkit completely at your disposal. With this comprehensive clinical playbook in hand, how will you choose to redesign your nutritional architecture? How will you take back control of your cellular health and permanently reverse your metabolic trajectory? The power to change your outcome is quite literally right in front of you. Thanks so much for joining us on The Explainer, and we will see you next time.